Hi, Stacy Tortorica here with Stalking Horse. Today we're going to talk about the CPC and the CRC. So we're going to actually talk about the differences and compare the two certifications and get into details about what each one means and maybe which one might be right for you. So we'll be right back. Stay tuned to hear about the CPC versus the CRC. Welcome back. So we're going to talk about the CPC versus the CRC. So the CPC is the Certified Professional Coder Certification, and the CRC is the Certified Risk Adjustment Coder. So we've seen a lot of questions come up in different forums about, should I get my CPC? Should I get my CRC? Do I need to have both? What would be better to have for a job? All kinds of questions coming in about those two certifications. So we thought it would be helpful to kind of break down those two certifications and talk about what they really mean and how they impact you in work and what it may mean for your coding future. So the CPC, or Certified Professional Coder, really means that you have a foundation for understanding coding that is multi-specialty across, again, the CPT book from soup to nuts, essentially, and also that you understand diagnosis coding and how that applies to the different coding cases that come up on the test and in real life situations, and how diagnosis codes support procedure codes, vice versa, so how they all kind of play in together. So it's really a foundational certification. And I feel that it's a super important one to have just in general because it shows, again, that you have a solid foundation for really understanding coding, at least outpatient coding and physician coding, from the base level. And the CRC, or Certified Risk Adjustment Coder Certification, focuses in on risk adjustment and ICD-10 coding. Now, it is important to note that it's not really a diagnosis coding certification per se, because it really focuses in on a narrowed group of diagnoses that are found in risk adjustment models. So it does, though, test you at a pretty high level as far as understanding some of the fundamentals of ICD-10 coding and the guidelines and how you use specificity to select codes. And it also makes you learn about the foundation of risk adjustment, which is an actuarial tool used to predict healthcare costs. And it makes you think about how risk adjustment works from the provider's office side as well as an insurance company side. So it really is more of like a specialty certification, and is not really meant to show that you are a, let's say a quote unquote well-rounded coder, or that you're a coder in general. You're then, a risk adjustment coder, but that doesn't necessarily mean that you could then get a job in a working on coding for a primary care physician or for an orthopedic, because you don't then have that other side, the CPT side of it, and understand everything about, ICD-10s with medical necessity and CPT and how that works for billing and so on and so forth. So the CPC really gives you that foundation, and the CRC really drives in on details for risk adjustment. So if I could make any recommendation on it, I would say I actually recommend getting both. And that's just because, again, the CPC makes sure that you understand coding in general from all sides. Really, it tests CPT, ICD-10, and even HCPCS. I didn't mention that before, but even HCPCS codes. So it really shows that you know what coding is and how to code, how to look things up, how to find answers that you need to code correctly. And then the CRC, again, hones in more on risk adjustment, which is like a subspecialty, if you will, within coding. As far as jobs are concerned, there are a lot of jobs out there right now, in particular for risk adjustment, and there's certain times of the year where risk adjustment jobs really explode. They really, really explode. But I will caution you that a lot of risk adjustment jobs that you obtain tend to be project-based. Not all of them, but a lot of them tend to be project-based, which means that you have a job, you're assigned to a particular project, but that project is only expected to last, let's say, so many months, or maybe 1 year. And then when that project ends, there's a very high likelihood that then you will not be employed any longer. You may have to find another project unless that project gets extended or that company brings on another project that then they can use you for. So with risk adjustment, it may be a little bit easier to get your foot in the door somewhere having that CRC like very quickly. But again, the position may be more short lasting, not as long lasting. If you have your CPC and your CRC, it does tend to make you a little more desirable. You can be used in more ways, and it tends to open the door for more positions that would last a bit longer, and you have more opportunity with that. That risk adjustment knowledge that you gain from the CRC will not be wasted on a job no matter where you are. That knowledge will not be wasted no matter what practice you work in, because risk adjustment also factors into quality measures, and whether providers know it or not, their data that they submit is being risk adjusted anyhow. So the risk adjustment certification along with the CPC certification just makes you even more well-rounded and more desirable for different positions. So again, if you stick with just the CRC, you may get more project-based work. You might be lucky to get your foot in the door of the company that has ongoing work and be able to build from there. But it is also super, super beneficial to get both. So again, my recommendation would be start with the CPC and then go into the CRC, and you will then again be very beneficial to any company, any provider's office, any group, anybody you get into with coding, because you're going to be even more well-rounded, again, understanding fee-for-service, CPT coding, ICD-10, HCPCS, and then also the fundamentals of risk adjustment. So I hope that you found this helpful. If you have any recommendations for future videos, please feel free to place them in the chat or in the comments. And don't forget to subscribe to our channel. And also don't forget that you heard it straight from the horse's mouth.